Yeah, it's so powerful. And, for anybody listening, the research, it's on PubMed, but it's basically the spontaneous talking time of patients at their initial visit. And a group of researchers just looked at how long will a patient talk if you don't ever interrupt them. You can encourage them and nod and smile and, keep going. I want to hear more. It's like 92 seconds. They'll just talk for about on average a minute and a half, and then they run out of gas. But a second group of researchers said if they won't, when you ask any doctor, like how long will will people talk for if you never cut them off? The answer is always like, oh, 10 minutes, 20, they'll never stop. I'll be there for an hour. And so another group of researchers looked at why is there such a disconnect if they're only going to talk for a minute and a half. And a different group of researchers looked at how quickly do doctors interrupt their patients. And do you remember what the timeline was there, Dwayne?
It was about 11 seconds.
11 seconds, yeah. And it's with the best of intentions. Dwayne, what's going on with your low back? You mind role playing real quick? So
yeah.
I say, Dwayne, tell me what's going on with what brought you in?
Yeah, I hurt my low back the other day, and I'm kind of feeling some go down my leg a little bit, which is like kind of scary because it's like lightning. And I mean, I've never had anything like this before.
And is it right leg or left leg?
I guess it's kind of both.
Yeah. So when I jumped in and asked right leg or left leg, doctors don't realize or providers don't realize. I just cut off Dwayne's flow of conversation. He was going to reveal that it's both legs. And sometimes when it's really bad, it leads to some urinary incontinence and he's, really scared and this and that. But as soon as I direct a conversation, it stops that kind of spontaneous, organic story he was going to tell. And we get down to what like an interrogation style of answering, right? And I'm glad you've seen the power of that. It's crazy when people, it's almost like, well, number one, people, for those listening that are willing to try this, when do you see typically people run out of steam? How long into their initial convo if you don't interrupt them?
Usually pretty quick. Yeah. It is far and few between when they go over about that 2-minute mark.
Yeah.
And the ones that do
long.
The ones that do are always the ones that have been to 6 different providers, and you can tell they're just like, I got to get all this out because no one listens to me. So, yeah, that you can tell those are the ones, and they always tell you they're like, I saw this guy, and I saw this guy, and I saw this guy, and this, and so yeah, most of them, I'm surprised if they get to that 2-minute mark.
And how quickly do you, in your mind, want to jump in and have to tell yourself not to?
2 seconds. Yeah.
Yeah. Yeah. It's so powerful just to sit there and listen. And I think, and it's amazing in that I always find in about the last 15 or 20 seconds of their initial dump is when you really truly hear what the reason that motivated them for. Like, I'm embarrassed I can't get out of a booth when I'm at lunch with my wife, or I'm scared I'm going to need surgery. They start dumping that emotion almost like we just spent 1 minute creating a safe place. All right, fine. I'll tell you the fear in me, and yeah, and then using those as the goals of the patient. Like, hey, we're going to do this gobble squat with this kettlebell because I don't want you to be scared to get stuck in a booth again. And they're like,
I think too, this is so powerful with, everybody has that guy in their town that they don't think is the best clinician that gets people better and everybody loves. Right. Yeah. And I think the power is that I've never met one of those guys, but I was like, he isn't that great at treating people. I know his treatment plan's the same for everyone, but everyone loves him. Right. It never fails. It's always like, man, I just love that guy. I love being around him, and there's magic to that. Like, people get better when they just enjoy being in your presence.
Yeah. It's funny. In all the research I've looked at around patient communication, never once is the method or style of treatment mentioned. Patients don't care if you're doing the ABC method and I do the XYZ, and they just came to you because you know more than they do, and it's like, try it. But in those, especially in chiropractic, we hear about these people that are doing the 50 to 100 visit plan and spending 2 minutes a time. I've also met those people like at conferences and whatnot, and they are just magnetic people that you're like, they make you feel interesting. It's not that they're interesting, it's that they make you feel interesting.
Yep.
And if they can create that in patients, it's like, wow, he actually listens. And I don't know why I go back. He's just such a great guy to be around. I'm like, wow. So harness it, why not harness that power? Just like placebo, like people talk about the effects. There's one great, I guess it would be a placebo study looking at patients that went through arthroscopic hip surgery, and one group got a weekly text message from the surgeon just saying, hey, I'm checking in, blah, blah, blah. And the other group didn't get anything. And then they check in at 12 months or 12 weeks. The group that got a message every week on average had 1.1 numbers lower on the 0 to 10 pain scale than the group who didn't. So you're not doing any sort of additional treatment, no rehab or whatever, just checking in. And instead of saying, oh, I'm at a 4 out of 10, they're at a 3 out of 10. And it's like, harness it, man. Grab it. It's like free right there. So
it's so easy. It's very easy. And I think it doesn't matter what profession you're in. All of us don't really care what it is that fixes people. We just want people to be better. So if you can make that happen really easy and free, let's do it.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by Trust Driven Care. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust Driven Care. If you're ready to streamline your practice, check out trustdrivencare.com and see what's possible. Trust Driven Insights, real conversations, smarter care, stronger business.